If you have spinal stenosis, you've probably noticed something strange. You can lean on a grocery cart and walk the whole store, but stand up straight to wait in line, and within minutes, your legs are on fire and you have to sit down. Same legs, same person, same day. So, why does bending forward turn the pain off like a switch? It's not random and it's not in your head. There's a specific anatomical reason, and once you understand it, four confusing things about your body suddenly make sense. In this video, I'm going to show you exactly why bending forward relieves spinal stenosis and why standing and arching backwards makes it worse. Then I'll use that one mechanism to explain four things that confuse almost everyone with stenosis: why you can bike but not walk, why certain gym machine quietly makes you worse, why seating feels great but isn't a free pass, and why you instinctively lean on the shopping cart. I'm Dr. Omar Ramos. I'm a spine surgeon at Twin Cities Spine Center, and this is the explanation I give patients in clinic almost every week, usually right after they tell me that they're embarrassed about how much they've started relying on the grocery cart. There's nothing to be embarrassed about. Your body's doing something smart. Let me show you what. Here's the whole thing in one idea. In spinal stenosis, the canal that your nerves travel through has gotten too narrow. When you bend forward on flexion, you actually open that canal up. The space increases. There's more room for the nerves. When you stand up straight or arch backward or extension, the opposite happens. The ligament along the back of the canal buckles inward, the joints crowd the space, and the canal gets smaller. Less room for the nerves that already don't have enough space. That's it. Flexion opens the door, extension closes it. Now watch how that one fact explains everything else. But before we get to that, you might be wondering, why did the canal get narrowed in the first place? Because this isn't usually one thing, it's three, and they tend to build up slowly over many years. The first is the disc. The cushion between the two vertebrae can bulge backwards into the canal, taking up space that used to belong to your nerves. The second is the ligament I mentioned, the ligamentum flavum. Over time, it can thicken, and as it thickens, it pushes inward from the back of the canal. And the third is the joints. The small joints at the back of your spine, the facet joints, can enlarge with arthritis, and as they grow, they crowd the canal from both sides. So you've got the disc from the front, the ligament from the back, and the joints from the sides, all slowly closing in on the same space. That's why stenosis usually happens as we get older and why it comes on gradually rather than overnight. And that's the key connection. Those three things set the baseline, how narrow the canal already is, but your posture moment to moment decides whether you're at the wide end of that range or at the tight end. That's the part you actually have some control over, and it's why the next four things can happen. So here's the first thing that confuses people. They tell me, Doc, I can ride a bike for 30 minutes, no problem, but I cannot walk to the mailbox. And they think something's wrong with that. It's actually not. It's very predictable. Look at your posture on the bike. You're lean forward the entire time. You're in flexion. The canal is open. Your nerves have room. Walking, you're upright. Some people even arch back a little as they stride. The canal is at its narrowest, right when you're asking your legs to do the most work. Now, sometimes patients notice that if they're walking at a faster pace, they can walk better. And again, they're leaning forward a little bit versus if you stand in place or walk at a very slow pace, then you're more upright, which can again narrow the space for those nerves. This is such a classic stenosis pattern that we actually ask about it in clinic. There's even a name for this kind of leg pain that comes on with walking and eases when you sit: neurogenic claudication. I bring that up for a reason. There's another condition that can cause very similar leg symptoms with walking. It's a circulation problem in the arteries of the legs. The two can feel alike, but they're completely different problems with completely different treatments. One clue is exactly what we've been talking about. Stenosis pain tends to ease when you bend forward, while circulation-related pain usually eases just from stopping, no matter your posture. But fits the pattern is not the same as diagnosis. That still takes your history, your exam, and your imaging looked at together. Now, the one that actually worries me a little, there's a machine in almost every gym and physical therapy clinic that for a lot of stenosis patients is working against them. The back extension machine, the one where you bend backwards against resistance to strengthen your lower back muscles. Strengthening your back isn't the problem is the position. Every rep drives your spine into extension. That exact position that closes the canal down. You're repeatedly putting your nerves in the tightest possible space under load. I'm not telling you to never touch it. I cannot tell you what's right for your spine from a video, and the right exercise program depends on your specific situation. But if you have stenosis and extension-based exercises consistently flare your legs, now you know the mechanism behind why. That's a conversation to have with your own physical therapist. Third one, a lot of you have figured out that sitting makes the pain stop, and it does. Sitting is a flex position. The canal opens, relief comes fast. So you might think, great, I'll just sit more. But here's the catch. Relief is not the same as a solution. Sitting all day brings its own problems, and staying locked in one position for hours, including sitting, generally is not ideal for your back. The goal isn't to live in the position that hurts least, is to understand why some positions relieve you so you can move through your day with that knowledge instead of being afraid of your own spine. Which brings us back to where we started, the grocery cart. When you lean forward on the cart, you're putting your spine into flexion and holding it there. The canal stays open the whole time you walk. That's why you can go around the whole store leaning on the cart, but 5 minutes without the cart, standing upright in the checkout line, causes significant discomfort. This is so consistent that clinicians have a name for it, the shopping cart sign. Your body found the flexion fix on its own before anyone explained the anatomy to you. So, why does bending forward relieve spinal stenosis? Because flexion opens the canal and gives your nerves room, and extension closes it down. One mechanism, and it explains the cart, the bike, the gym machine, and the chair. Now, understanding why your symptoms behave this way is powerful, but it doesn't replace having your own spine evaluated. Stenosis is diagnosed by looking at your symptoms, your imaging together, and your examination, never one without the other. I want to be clear why that matters so much. Plenty of people have narrowing on an MRI and feel completely fine, and some people have symptoms that don't match what the pictures show. The imaging only means something when it lines up with what you're actually feeling and what the examination shows. That's why a video, any video including this one, can explain the mechanism, but it cannot tell you what's going on in your specific situation. If this explains something you've been living with, two things. One, I made a whole video on what actually helps stenosis without surgery, and it goes deeper on the management. I'll link to it. And two, there's another video on the question that patients have next. Do I actually need surgery, and how do you decide? So I'll put links to both of these videos on the description. If you learned something from this video, please subscribe. I'm working on a series of videos to teach you more about your spine and help you make better decisions. I'm Dr. Omar Ramos. I'll see you on the next one. One last thing, and it matters. Everything I've explained here is general education about how spinal stenosis works. It is not medical advice for your specific situation, and I'm not your doctor. I can tell you why bending forward tends to open the canal. I can't tell you what's happening in your spine because that takes your symptoms and your imaging looked at together by someone examining you in person. So if your symptoms are getting worse, or you've got new weakness, numbness, or any change in your bladder or bowel control, don't wait on a video. Get evaluated. That's not me being cautious for legal reasons. That's the actual right move for your spine.